Living with issues of the reproductive system can be emotionally and physically challenging for a person. A lot of emotions can be felt when the diagnosis is done or when the symptoms begin to show. A sense of loss, low self-esteem, mood swings, and even depression might set in. However, there are advanced medical researches and proven methods that have been used to combat most of the diseases of the reproductive system, especially the prostate. There are also some medications and supplements that have been used to successfully prevent or even combat some prostate diseases and disorders. The best prostate supplements contain some natural ingredients known to improve prostate health. Let us learn about the prostate gland. Before we talk about these supplements, let us take a look at the prostate, how it functions, some prostate problems, how to detect them. The prostate. The prostate is a small muscular gland located to the anterior end of the rectum and below the bladder. It is a gland of the male reproductive system that produces a fluid that protects the sperm. It is only present in males. The urethra runs through the center of the prostate gland and lets the urine out of the body. When ejaculation takes place, the prostate contracts to release fluid onto the sperm for its protection, nourishment, and the preservation of their genetic codes. The vas deferens, two tubes that carry sperm cells from the testicles, carry millions of sperm cells and prostatic fluid to the seminal vesicles, where more fluids are released to form the semen at the ejaculatory duct. When the prostate gland contracts during ejaculation, it closes off the bladder from the urethra and pushes sperm with a great force through the urethra. That is the reason urination and ejaculation cannot take place simultaneously. Structure and function of the prostate. The prostate is divided into the left and the right lobe. The seminal vesicle is found on both sides of the prostate. The upper part of the prostate, known as the base, rests on the lower and narrower part known as the apex. The prostate is surrounded by muscle tissues called the stroma, which makes it elastic. It is also covered by a thin connective tissue known as the capsule, which makes it smooth. It also contains a lot of ducts that secretes the prostatic fluid. The prostatic fluid is a milky liquid that makes up to 30% of an ejaculated semen. It is useful in protecting the sperm, keeping the sperm cells alive and helping them move. It is made up of zinc, citric acid, and enzymes like prostatic-specific antigen (PSA). The enzyme helps to make the semen runny when it begins to thicken so that it can successfully travel through the female reproductive system. Hormones like dihydrotestosterone and testosterone help in the proper and timely production and ejaculation of this fluid by the prostate gland. The prostate is made up of 4 zones. 1. The peripheral zone. This zone, which is located at the back of the prostate gland, is the largest part of the gland. This is where the prostatic fluid is mainly produced and is the most likely zone to be affected by cancer. 2. The transitional zone. This zone surrounds the urethra, which runs through the prostate gland, known as the prostatic urethra. It is the smallest zone and keep growing as long as the man lives. The abnormal growth of this zone, which can eventually lead to the inability of the bladder to empty urine into the urethra, is referred to as prostatic hyperplasia (BPH). 3. The central zone. This makes up about 30% of the whole mass of the prostate mass. It encompasses the ejaculatory duct, which is the point where the seminal vesicles meet the urethra. This area is prone to cancers. 4. The anterior fibromuscular stroma. This is found in the capsule and consists of fibrous and muscular tissues. This surrounds the apex and is quite thick. No glands are present in this zone, and cancer of the prostate does not occur in this zone. Let us look at some prostate problems. 25% of men above the age of 50 have a prostate problem. The percentage increases to 50 by the age of 70. Some of these prostate conditions show no symptoms. At the age of 50 and above, routine checks of the prostate gland are recommended, especially if there is a family history of prostate problems. There are 3 main forms of prostate conditions, and one can experience one or more at the same time. They are: 1. Prostatitis. This is also known as the inflammation that occurs in the prostate gland. This is not a common type of prostate problem. This can affect men of all ages but is more common in men between the age of 30 and 50. There are two broad types of prostatitis, the acute and chronic prostatitis. It is usually caused by a bacterial infection. It has painful symptoms like chills, fever, pain, and difficulty in urination. The bacteria causing this inflammation is usually discovered using a urine test or the prostatic fluid culture test. Acute bacterial prostatitis has symptoms that are sudden and require immediate attention, while the symptoms of chronic prostatitis occur periodically. 2. Chronic pelvic pain syndrome (CPPS). This is also known as chronic or non-bacterial prostatitis. It is the inflammation and redness of the gland and the nerves that supply signals to it. It is not regarded as an infection. Symptoms of the CPPS are painful urination, painful ejaculation, pelvic, penis, bladder and testicle pain. It is caused by a lot of factors. It is sometimes caused by stress, anxiety, nerve irritation, infections of the urinary tract and accidents. Other causes of chronic prostatitis are cancer, enlargement of the gland, prostate stones, reaction to some chemicals, and the presence of scar tissues. 3. Asymptomatic inflammatory prostatitis. This type of prostate inflammation usually has no symptoms. They are detected when other prostate tests are being carried out. 4. Benign prostatic hyperplasia (BPH). This is also known as a non-cancerous enlargement of the prostate gland. 50% of men between the age of 50 to 60 and 90% of men above the age of 80 have this condition. There are two growth phases of the prostate in a man's life, during puberty and after the age of 25. The first phase results in the rapid growth and doubling of the size of the prostate. The second phase occurs from the 25 years and above. Benign prostatitis hyperplasia usually occurs in the second phase of prostate growth. When this enlargement occurs, it begins to constrain on the bladder and the urethra. Subsequently, the bladder will no longer be able to empty urine out of it completely and the urethra gets narrower. Benign prostatitis hyperplasia is not cancerous but can occur at the same time with the prostate cancer. BPH is believed to be caused by age and the testicles, since the condition is usually absent in people who had their testicles removed at a younger age. Symptoms of BPH are reduced urine flow, need to urinate even after emptying the bladder, an urgent need for urination always, straining of the pelvic muscles before urine can flow and lack of the ability to urinate. Prostate cancer. This is cancer that forms in the prostate and can spread around the body through lymph nodes and blood vessels. Wherever they land, they attach to other tissues and form more tumors that resemble the original tumor. The symptoms are frequent urination, pain during ejaculation, back pain, hip pain, poor appetite, bloody urine, weight loss, and a weak flow of urine. Diagnosis of prostate problems. Prostate conditions can be detected using some tests like 1. Digital rectal examination. This is done by the patient bending over and the doctor inserts a finger into the rectum to feel the thickness and shape of the prostate. If the prostate is tender or enlarged, it could be an indication of acute or chronic prostatitis. The feeling of pain during the test could be due to prostatitis. The presence of lumps could indicate the presence of prostate cancer. 2. Prostate-specific antigen (PSA) test. The PSA is an enzyme found in the prostatic fluid secreted by the prostate. Low level of PSA in the blood indicates a healthy prostate. Therefore, the PSA test measures the quantity of PSA contained in the blood. Prior to the test, the patient is advised not to ejaculate at least 48 hours before the test is carried out. This is because the quantity of PSA in the blood increases after ejaculation, and this increase can last for up to 2 days. A rise in the level of the PSA in the blood is one of the resultant effects of benign prostate hyperplasia (BPH). 3. A midstream urine test or urinalysis. This is the test carried out in the midstream to determine the cause of the inflammation. 4. Urine flow test or uroflowmetry. This is the measurement of the strength of the flow of urine. This is used to detect any form of blockage of the bladder caused by infections, the urethra, pelvic muscles or an enlarged prostate. Biopsy, this is a minor surgery carried out on the prostate to collect tissue samples to be examined. This is the only way to find out if there are cancerous cells in the prostate. The biopsy is carried out by first taking the ultrasound of the prostate to find out its size, shape, and presence of any abnormality. This is done using a probe that is inserted into the rectum. After numbing the prostate gland with anesthesia, a biopsy needle is used to collect some samples for screening. Following the biopsy, there may be blood in the semen, urine and even stool for some days. The severity of cancer depends on the number of cancerous cells present in a sample. The quantity of tissues to be collected as ample depends on the family history of the patient and the results of former biopsies if any. 6. Cystoscopy. This is the examination of the prostate, bladder, and urethra using a cystoscope. A cystoscope is a long telescope that is thin and has a light at one end. The urethra is numbed while the urologist inserts the cystoscope inside the bladder through the urethra. 7. Urodynamic pressure. This is used to test the pressure in the bladder during urination. 8. Post-void residual volume. This is done to measure the quantity of urine left in the bladder after urination. What is the best natural supplement for prostate health? Natural supplements that can be used to manage benign prostate hyperplasia and relieve other symptoms of prostate disorders are 1. Pygeum. This is an extract from the bark of the plum tree. It contains chemicals that help the enlarged prostate to contract so that normal urination can occur. It can also help them to sleep longer at night without taking trips to the bathroom. 2. Beta-sitosterol. This substance contained in many plants and supplements like azuprastat and harzol has been known to relieve users of the symptoms of BPH. It is known to help in the total emptying of the bladder and the increase in urine flow. 3. Saw palmetto. This is a type of palm that grows in North America. Its berries are used to make supplements that can be useful in reducing the size of the prostate and reduces the frequency of urination in BPH. For more details on how to buy the best prostate supplement on Amazon, click on the link in the description below. Did you find this video helpful? Subscribe to our channel and turn your notification on, so that you will know once we post a new video. Do not forget to visit our site, www.zymsupplementsguide.com for more supplement content. Thank you. Per night only to be frustrated by very little quantity of urine. Some supplements contain only extract, which takes away from the synergy of the whole plant in its natural state. By taking the powder of the whole berry, you can be sure to gain all the benefits. It contains several natural plant sterols, including beta-sitosterol known to support prostate health. It also may help block 5-alpha reductase, an enzyme that converts testosterone to DHT. It is produced with the highest quality ingredients in an FDA